Welcome back to Medicare and More. It's a program that is sponsored by the Central Massachusetts SHINE program. And I'm very pleased to have this morning a guest with me, Kathy Devine, who is with the Executive Office of Elder Affairs in Boston. And Kathy is the Outreach Coordinator for the Prescription Advantage program. So welcome, Kathy, to our show. I'm so glad you're here.
I'm so glad to be here, too. Thank you for inviting me.
So please tell us, Kathy, what exactly is Prescription Advantage?
Well, Prescription Advantage is what we call a state pharmacy assistance program. Okay. Now, not to be confused with a Medicare Part D plan or a Medicare Advantage plan or any other insurance that somebody may have. And I think that it's important to realize that Prescription Advantage is not going to replace something somebody already has, but it's there to help supplement. So it's an assistance program that will work with your Medicare prescription drug plan to help lower your co-payments.
And that's a good point, because I think a lot of people get very confused about that same point. Prescription Advantage is not a plan. It's not a drug plan at all. It cannot furnish you drugs. It can only help subsidize the plan that you're currently in.
That's right.
So it works with Medicare drug plans, and it also works with Medicare Advantage plans as well.
Works with both.
So that's wonderful. So can you tell us, how long has it been around? How long has it been existing?
Well, Prescription Advantage as a program has actually been around since 2001. So it's been quite a while. And when it was first developed, it was there to fill a need to be able to have prescription drug insurance for our seniors in Massachusetts. But then in 2006, things changed, because then Medicare finally had prescription drug coverage that would be available. So we went at that time from being a primary prescription drug program to a secondary, to be a secondary to the Medicare prescription drug coverage.
So that's very interesting. So once upon a time, it was a drug plan. It was a drug plan. And then when Medicare D came out and the Medicare drug programs came out, it kind of metamorphosized into this subsidy.
Exactly.
So that's very
it
interesting.
Shifted.
So can you tell us, Kathy, who can apply for Prescription Advantage?
Okay. Well, being a state-sponsored program, I think the first thing that's very important is that our members must be residents of Massachusetts.
Logical.
But we do have benefits at different levels. We have benefits for people who are age 65 and over, and if they have a Medicare prescription drug plan, or if they have coverage, say, through a former employer, people who might have been municipal employees that have, when they retired, they have coverage that was an added benefit. We can be a secondary payer to that. We also have coverage for people who are age 65 and over who are not eligible for Medicare. And I find that, these are people who possibly moved to this country later in life. They may not have worked long enough to have met enough quotas with Social Security. Maybe they never worked at all. But because they're not eligible for Medicare, they are somebody that we would be able to provide primary prescription drug coverage to. And also, we do have benefits available for people who are age 65, for under age 65, who may have a disability, and they would need to meet our income and disability guidelines.
That's very interesting, and that's an interesting point to point out, that so even if a person has a retiree plan of some sort, okay, if they're finding that the co-pays on their plans are expensive, they can see if they qualify for Prescription Advantage, they maybe have some additional subsidy to the current plan that they have, even if it's not through Medicare. But also, I'm assuming then, if somebody was a veteran, they might be able to also get some assistance as well if somebody was a veteran.
Prescription Advantage will be a secondary payer really to any other primary insurance. So if somebody is using their VA benefits and having their prescriptions filled through the VA, we could be a secondary payer to that as well.
That's very interesting. So if somebody has a Medicare prescription drug plan, or they need a prescription drug plan through Medicare, why would they go through Prescription Advantage?
Well, Prescription Advantage is a secondary payer to Medicare. It's really there to help fill the gaps, to help fill the holes. And I think you know where I'm going with this
Yep,
when I
do.
say fill the hole. There is that gap in the Medicare prescription drug plan that I think a lot of people have heard about it because it's often referred to as the donut hole. You know, this is a time when people reach that coverage gap that they find their out-of-pocket costs are going to go up quite a bit. And this is where Prescription Advantage can help lower those costs.
Exactly. And we do see that, and Kathy, I think this is what you were referring to. This is the kind of the time of year where maybe somebody was going along on their Medicare Advantage plan or their drug plan, and they were doing okay with their payments, and then all of a sudden, boom, the price changes. And now they're finding it very expensive to be able to pay for their medications. And this is where Prescription Advantage, if somebody qualifies, could step in and be some sort of help.
You know, and that unfortunately comes as quite a shock to a lot of people. They don't realize that they are about to hit that coverage gap or that donut hole, and oftentimes they don't realize it until they're standing at the pharmacy someday, and they may have had a prescription that they were used to paying that $20 or $30 copayment for, only to find out now they have to pay over $100 for that same prescription, and they don't know what happened or how it happened. But this is when they do, because they have reached that gap.
Yes, and that could be very shocking. So with that said, and since this is a state-sponsored program, are there any sort of income guidelines or asset guidelines with this particular program?
There are income guidelines, and I think you're going to find that with any state-sponsored or even a federally sponsored program. The nice thing with Prescription Advantage, though, is that we're only looking at income. We do have a cap on what a person's income can be, but we don't look at assets. So oftentimes people will say, I would never qualify for Prescription Advantage because I own a home. Well, that doesn't matter. That's an asset. Or I have an automobile. That doesn't matter. But we do look at gross annual income. So for an individual, their income cannot exceed $58,000. For a married couple, it cannot exceed $78,000. Those are very generous income guidelines.
Very generous.
But it also depends, we start at zero and, we go up to that, but depending on where a person's income falls, that's going to determine, what level of benefits they're going to receive and when their benefits are going to begin.
So speaking of income, then when a person is going to go to apply, what is it that a person would need to provide for documentation to verify their income? So what kind of paperwork do they need to get together for you?
It actually is pretty simple. If somebody still files federal income tax forms, then what we would ask for is a copy of their most recently filed federal income tax form. And all we need is the first page. Now, if part of their income is Social Security, then in addition to that federal income tax form, we would also ask for a copy of their 1099 from Social Security or a copy of their annual award letter. And that's the letter that goes out in December that tells people what their Social Security benefit is going to be for the following year. So it would be either or, the 1099 from Social Security or that annual award letter, along with the federal income tax form. Now, if somebody does not file federal income tax, they get to a point where they no longer file, then we would just ask for any 1099 from any source of income that they receive, which for many people that might just be Social Security, or it could be pension income.
Exactly, and again, there's no assets. So the program does not look at assets, which is rare for state programs.
It is.
So that actually is a huge benefit as well. So yes, they have income limits, but there are no asset tests, so to speak. So with that said, the donut hole, can you explain a little bit more about the donut hole?
Yeah, let's talk
and
about
how
that.
Prescription Advantage works?
And I know, Kerry, that you you hear this all the time. You know, all of our Shine counselors hear this all the time. People would say, oh, I'll never reach that coverage gap because I only have one prescription. Or, you know, all my prescriptions are generic. I'll never reach that coverage gap. Well, people will reach the coverage gap, and now this is starting in January because, you know, the new Medicare year, it starts every January, and with every prescription that a person has filled, Medicare is keeping track of what the individual paid for their copayment, but also what their insurance paid. So if you had, let's say, a prescription that was the retail cost of the prescription was $100, you might have paid $20, but your insurance paid the other $80. Well, Medicare is adding up both, the $20, the $80, that's $100. And Medicare is going to continue to add that total retail cost of every prescription until that total reaches $2,960. So that's the magic number, $2,960. When you reach that, you have now reached the coverage gap. So that means your next prescription, if it's a generic prescription, and maybe you were used to paying $10 copay for generics, well, in the donut hole, for any generic drugs you take, you'll now be responsible for 65% of the cost of the drug. Mm-hmm. And you and I both know that generic doesn't always mean inexpensive.
That is true.
You could very easily have a generic drug that cost $100, retail cost. Now you are responsible for 65% of it. Ouch. Mm-hmm, exactly. You would have to pay $65. Mm-hmm. For brand name drugs, it's 45% that a person is responsible for. So what we'd like to make people realize is it's the total cost. So if somebody said to me, I would never reach the coverage gap because I only take one medication. Mm-hmm. So my first question is, well, what is that medication and what does it cost? So if you have something like, say, an inhaler, which inhalers could cost $300, $500. Mm-hmm. Again, the individual might say, but I only pay $30. Mm-hmm. I'm fine. Yeah, it's a $300 inhaler, but I pay $30. I'll never reach the donut hole. And you know, it's like Medicare is keeping track of the $30 that you paid, in addition to the $270 that your insurance paid, your Part D plan. Well, in 10 months, you're in the donut hole. Mm-hmm. Yep. And instead of hearing, when you go to get that prescription filled in October, you're not going to hear that'll be $30. You're going to hear something more like that'll be like $142. Mm-hmm. That is really quite a shock to people if they didn't realize it. And this is the point where Prescription Advantage can help.
And that's very good information. So I guess the next question that kind of leads into that is, mm-hmm. Is there a limit to how much Prescription Advantage will pay for a person?
No, and this is one of the nice features of the program. We don't put a limit on what we're going to pay. We're actually putting a limit on what you're going to pay. And we call it an out-of-pocket spending limit, which means starting in January as a Prescription Advantage member, we're keeping track of how much you're paying in your copayments. And depending on what membership level you're at with Prescription Advantage, if you reach that out-of-pocket spending limit, that's when we're going to say, put your wallet away. You don't have any more copayments for the rest of the year.
That's a very big help. That's a very, very,
it is.
That's a big thing.
You can look at that, you know, if you have a lot of prescription drugs, which many people do, mm-hmm. They have a lot of prescriptions, which means they have a lot of copayments. And even with insurance, you're spending a lot of money out of your pocket, but you could look at that cap and say, well, at least I know this is the most I would have to spend.
So that's good. Mm-hmm. But with most state programs, again, we know there's some limits. So with this particular program, are there any costs associated? Do you have to pay anything to be a part of Prescription Advantage?
I mentioned the income limits, and I said, you know, as for a single person, it goes up as high as $58,000, and for a married couple, it goes up as high as $78,000. But we do have a limit where, for a single person whose income does not exceed $35,000, or a married couple if it does not exceed $47,000, so anywhere from 0 to those amounts, there's no charge for Prescription Advantage. It's free. Okay, it's just when you get over those limits to where the program caps off, okay, that is when there is a $200 annual enrollment fee.
So can you explain that a little further about, I know for those of us who know what that is, it's called an S5 category.
Yeah.
So S5 is when somebody's got a little higher income. Now there is a $200 annual fee to be a part of the program.
Yeah.
Can you explain a little bit about how, you know, because during the year Prescription Advantage keeps track of how much somebody's spending on their drugs, and that's a little different for people who are in the S5 category.
Yeah,
Can
for
you
people
go into
who
that a
are
little bit
in
more?
that highest income level that we have, Prescription Advantage benefits are not going to become effective until that individual has spent $3,500 out of pocket, and that's in copayments. So, and this also is while they're a Prescription Advantage member. So if somebody is a member in, let's say, for the entire year, they were a member in January, and with every prescription that they get filled, we know how much they're spending out of pocket because the pharmacy is billing us as a secondary payer. And we are keeping track of how much the person is spending. So we may not be paying at that point because we are adding it up. We're not going to start for members in that category until they have spent $3,500 out of their pocket. At that point, then we would start to cover their copayments at 100%. So for members in that higher category, it's really a benefit that I have to say for $200, they're really buying more like catastrophic coverage. And for people who are in that income category but have very high drug costs, they might look at $3,500 and say, you know, that's all I have to spend? And, you know, I know you and I have both met people with, you know, chronic diseases that have very expensive drug costs. And I have had somebody say to me, last year I spent $12,000 on my prescription drugs. That was just my copayments. If I only have to spend $3,500, that's a huge savings. So it really depends on the individual, and that's, you know, oftentimes I say it's well worth sitting down, talk to the Shine counselor, go over what are your prescriptions, you know, what are your costs, where does your income fall, because for many, many people, that's $200 well spent. And of course, for other folks who they're not quite at that highest income level, there's no charge for Prescription Advantage, and we are able to help them when they reach that coverage gap or that donut hole.
So it seems like Prescription Advantage runs along the same year as Medicare.
Right,
So
it's
Medicare,
a calendar year.
It always starts at January and then goes through the end of December. So Prescription Advantage essentially does the same thing.
Exactly.
So with somebody who's in the higher income bracket, that S5 bracket that they'd have to pay for being a member, now because the membership, the clock starts ticking, or when you start taking into account how much spending on someone's medications when they become a member, then it's kind of critical what time of year they actually become members.
It is, and the first thing I would ask somebody is, particularly if they came to me in October and I realized that, all right, you're going to be in that highest membership category, it will cost you $200, my first question would be, would you spend $3,500 between now and the end of the year in copayments? And if they say, oh, no, you know, I've already spent that, but, you know, it wouldn't be anywhere near that, then I would say, well, you know what, let's hold off on this, and because it's not going to help you between now and the end of the year, but let's do this so that it will be effective as of January 1st, and that way we're counting every copayment that you spend.
And that's key, because otherwise you need to be able to count those co-payments in order for someone to kind of accumulating
That's
those
right.
payments until they reach over $3,000 in their cost. So that's critical. So
Yeah.
January is kind of the critical time for,
It is.
for
And-
somebody getting into the program.
And I think with any of our members, the most important thing too is that they make sure that their pharmacy knows that they have Prescription Advantage, or if they're using mail order, that their mail order company knows, because we rely on the billing. This is how we know when our members reach the donut hole, because the pharmacy has been billing us all along. We haven't been paying, but we're keeping track. But we know at that point, we will know the day that they reach that coverage gap, and we're there to help lower those co-payments. That example that I gave you of somebody with the inhaler, that say in October, they went from paying $30 for a co-payment to now being told they're being charged $142. Well, what would happen is the pharmacy would bill that $142 to Prescription Advantage. And then Prescription Advantage would say, yep, she's in the donut hole, and according to the membership category she's in, charge her $18.
Big change.
It's a big, big savings. So that's what Prescription Advantage is there to help when people really need us the most. You know, it's when their costs are going up because they've reached that coverage gap, and we're going to be able to help lower it.
And another thing, besides helping with the copay on medications, is that Prescription Advantage also has a other neat feature to it. So let's say somebody had a Medicare drug plan and they're going along through the year, and then they have a doctor visit, and then all of a sudden doctor says, well, sorry, I got to put you on a very expensive medication now, and you discover maybe your drug plan that you have right now doesn't cover it. What are you going to do?
Of course, it happens.
Please tell us something Prescription Advantage can do to help.
Well, Prescription Advantage, as a state pharmacy assistance program, we have one additional time a year that members can make a change to their Medicare prescription drug plan. This is a huge benefit.
It's huge.
Because your situation can change in the blink of an eye, and you never know when that's going to happen. So I think the example that you gave is perfect, because during Medicare's open enrollment, which is just a little window of time every year, October 15th to December 7th, people are making their decisions on their drug plan based on the drugs they're taking at that time.
At the moment, yep.
And come January, everything's fine, but then come June, you get that new prescription. It's not covered by your plan, but if you belong to Prescription Advantage, you have that one additional time now that you can make a change. You don't have to wait until October. You can look for another plan. Shine can help you with that.
We can.
And look for another plan that's now going to cover that prescription and make the change.
Now, is this a special enrollment period is what that's called as
It
far
is.
as Medicare is concerned? That's
Exactly.
the Medicare terminology. You're allowed a special enrollment period per year when you're a member of Prescription Advantage. So it applies to Medicare prescription drug plans, but does it also apply to Medicare Advantage plans?
To both.
To both.
To both Medicare Advantage plans and Part D plans. So somebody may be in a Medicare Advantage plan, and then the same thing could happen, where all of a sudden there's a change. And it could be something that now the change may no longer cover a certain drug, or now they've been prescribed a drug that isn't covered. And they say, you know, I think I might be better off just going back to my regular traditional Medicare and get a Part D plan. They can do that. They can make the change at that time.
That's a very interesting thing. So now we've talked about all the wonderful things that Prescription Advantage can do. How do we contact Prescription Advantage and how do we start the application
Yeah,
process?
get this application going. We couldn't make it easier. We have a few different choices. First, we have a paper application, which somebody could obtain by calling Prescription Advantage directly. And I don't think we've mentioned the phone number for that yet, but it is a toll-free 1-800 number, and it's 243-4636. And of course, you will get, the little prompts. You press 2, and you'll go right to Prescription Advantage. And you can ask them to mail you out a form. But while they have you on the phone, they would even offer to do that application right over the phone with you. So they'll say, if you prefer the paper, we can put that in the mail to you today, or we can do it right now. We also have a website, and our website is www.prescriptionadvantagema.org. So that Prescription Advantage MA, it's all one word, MA for Massachusetts, and then .org. Go to our website. You'll find our application forms there. So if you still wanted the paper form, you could easily print one off, or you could go to our online application and just fill it in. And I know you're a fan of that.
I am a fan. I'm a convert. It works very, very well. So if somebody's interested in the online application, it is so fast. It's easy, it's fast, it's slick. So, and then you just press submit and it's in. So, but I guess one of the biggest challenges to doing the online application, or even the application over the phone, is people following up with their information. We really need to make sure that people
income
follow
documents,
up.
that's
Exactly.
right. So you will get a message reminding you that, when you do an online application, or even if you were doing the application over the phone, the customer service representative is going to explain all of that with you. You will also get a letter in the mail within a couple of days, again, reminding you of what you need to send us. We talked about the first page of that federal tax return, the 1099 or annual award letter from Social Security. We don't ask for a lot of documents, but it's getting them to us, and we do need those to be able to process the application and determine which membership category you should be in.
So thank you again for joining us with Medicare and More, our TV program about Medicare and different benefits. And thank you again, Kathy Devine, for joining us. Very much appreciate you coming all the way out to be with us this morning and explain this really beneficial program that a lot of people can take advantage of. It's good stuff for a lot of folks. So thank you again.
Thanks for having me.